So we're going to concentrate on the second vaccination process, which we're going to undertake in Ealing. So if we just put up the slides, please. Is it Shanker or Alex?
I'll put them up. Just one sec.
Okay, thanks. So the areas that we're going to cover this morning are, first of all, we're going to talk about the transition from S1 ledger to the accuBook ledger. And as you all remember, we started using S1 on the 18th of December when we first started the vaccination program rollout, and then we moved over to accuBooks on the 24th of January. So we're going to describe the upload and invitation process with respect to all those patients that were on the S1 ledger in those first approximately 4 weeks. Then secondly, we're going to talk about the integration with the NHS Immunisation and Management Service, and Shanker is going to describe some of the data issues which every practice needs to be aware of. And then finally, I'm going to give a quick update on the role of accuBook and how we're going to book our staff for this second vaccine. And then as any other business, I'm just going to give you a brief update on where we've got to with respect to accuBook and cphouse for the remaining of our priority 1 to 6 that are still waiting for their first vaccine. So I'm going to hand over now to Alex, who's going to take over in terms of the next steps.
Okay, thank you, Vijay, and hopefully everyone can hear me. I'm Alex. I'm one of the clinical leads for the CCG, and I've been working with Shanker and Vijay on accuBook and also the vaccination program. So just to kick off, again, apologies for repetition here, because a lot of you may have seen some of these slides already, and Shanker's posted in the chat. A lot of the content is the same with very minor differences, so you don't have to watch all this again, but there are a couple of more detailed bits about the booking process that we will introduce today. So this slide is just mainly around the overall process of how you invite patients, both for first and second COVID vaccines, but particularly what we're interested in is the right-hand side of the flowchart. Because we're looking at patients who were invited for the first 4 weeks approximately of the vaccine program through searches on System 1 and were uploaded onto a System 1 ledger, so they were not on accuBook. So really for those patients, because they're not on accuBook, they need to be put onto accuBook so that the NIMS integration function of accuBook can clarify whether they've had a first immunization and are awaiting their second COVID vaccine, or whether they haven't had any vaccine yet, in which case they would need to be invited as a first vaccine patient. So as we follow the flowchart down, if they're awaiting a second COVID vaccine following the NIMS integration check, then they can be invited for specifically second vaccine sessions, which will ultimately be set up on accuBook and published so that practices can start booking these patients in. So that's really a basic gist of the invite process. And in terms of just a couple of screenshots, you will probably have all seen all these in your experience with accuBook, but when you have uploaded your patients who need potentially second vaccines, you will see that there are some new options on the left-hand side on the filters area. So if you tick the awaiting invite second, there's two further sub options. One is for patients who are more than 10 weeks since their first vaccination, and underneath it, patients who are less than 10 weeks since their first vaccination. I think I can hear somebody not on mute. I've had to mute some people manually over the last few minutes. So if you could just go on mute, please. Thanks. So the other element of the screen that's new is that the invite to second vaccine that you can see here. So when the time comes to invite those patients into sessions, that would be what you tick. That will be what you press, and you can invite patients individually or as a group. Okay, so to follow on from that, so after you've uploaded the right amount of patients and the correct cohorts, you can then start to invite. And this is a screenshot of a familiar screen with regard to the text message that you would send to those patients. So moving on to which patients are we supposed to invite? This is really important because, as we mentioned earlier, and we'll probably repeat ourselves a lot during this talk, but there were two different methods of booking patients for vaccinations. There was the System 1 method, which was from December all the way up till the latter part of January, so almost for a whole 4 or 5 weeks, I think, in total. And then after that, we used accuBook almost exclusively beyond that point. So this process that we're talking about here is mainly for the patients that were on a System 1 ledger, okay? Hence why we need System 1 reports to pick up the patients that were vaccinated for those first 4 to 5 weeks. So our Federation colleagues have very helpfully created some reports for us so that it's not necessary for practices to create new reports to find these patients. So if you look on the report tree on the left-hand side, if you go through to the Ealing GP Federation folders, COVID-19 vaccinations, and then second vax section, you'll see a whole lot of reports here. I've highlighted with red the ones that are probably the most important, and they're split by dates. So, for example, the first one is everyone who had a first vaccination before the 27th of December. The second would be everyone who had a vaccination between the 28th of December and the 3rd of January. So they're split by weeks. Okay, so effectively each report will give you the original week number of the vaccination program. So the first search is week 1, second week 2, third week 3, and so on and so forth. And if you remember, the patients are supposed to be invited and have their second vaccination at a time point between 10 to 12 weeks since their first vaccination. So that's a really important point, that we've got to get the timing right. We don't want to invite patients too early for their second vaccines, and we don't want to invite patients too late either for their second vaccines, because both of those eventualities have problems attached with them.
Alex, could you just go back to that slide once again? I just want to pick up one point here, is that as you remember, when we first started, we were doing primarily doing the 80 plus cohort groups. And so if you look at each of those individual searches, when it's breakdown by the week, you can see it says aged over 75 and above. And then you've got age over 50 care home, age over 75 housebound, and then everyone else. So it's important that you run the search which says age over 75 and not in a care home or housebound, because that will pick up the population card that we originally did using System 1 ledger. Because if you, for example, use the everyone else search, it will pick up other practice registered population who've had the vaccine very early on, who are potentially frontline workers working in hospitals or working in other care settings, who had their first vaccination elsewhere at another hospital site. So it's important that you just run that age over 75 to pick up the ones that we did on System 1.
Yeah, that's a very good point. So thanks for raising it, Vijay. So again, exactly. So, and this leads us on to the next slide. So we do have to follow the JCVI groups, which we originally started vaccinating according to. And so the initial reports run will need to be for those patients over 75. Leading on to the next slide, the important thing here is we really mustn't upload everybody onto the second invite cohort in one stage, because the problem with that is that there's going to be a capacity issue with the sessions that are available. So accuBook will not allow you to upload huge numbers of patients if you don't have the capacity in potentially booked sessions, bookable sessions, to actually match those patients with a booking. So it's important to phase the uploads, and there will be comms released after we have had a more detailed discussion with the PCN clinical directors later today, hopefully, around the sessions that they're planning to make live and set up for second vaccines. A lot of this is frustrating because the CDs are not really able to put up sessions when they don't know what vaccine supply there will be. So it's not anybody's fault in particular that the sessions are not put up yet. But we appreciate that it's difficult for practices to plan for this and to invite patients without there being sessions up to invite to. So what we're proposing is that it's probably safe to start to upload patients who were vaccinated up until the 31st of December, again with the caveats that Vijay mentioned, so the over 75s of that cohort. And when I say invite, I mean upload. I mean upload. I don't mean invite. So uploading to accuBook is separate from inviting. Okay, so we're uploading first, and then when the sessions are released for booking, then they can be invited. Okay, so the next slide is just really, you may or may not find this useful, but it's just a visual representation of what we're actually doing. Okay, so on the left-hand side, you've got the System 1 first vaccine reports split by week. So I've put there all the first 5 weeks of vaccinations that were happening, first vaccinations. And then across the top, we've got the current time and future months. And effectively, what we're saying is that for each of the System 1 vaccine reports, they will be matched to a corresponding week of second vaccination sessions. Now, these rhombuses and diagrams are not completely accurate yet because we don't have the sessions published, but it just gives you an idea of what we're trying to do and how to phase this. And how we're trying to phase this. And the red lines and arrows just signify when we started using accuBook, from which point onwards. Although I appreciate that there would have been some overlap, it wasn't a totally clean switch over. There was a period of around a week where we were doing some double running. But effectively, more or less from the end of January onwards, we started using accuBook. So the second invite process we've just discussed with the System 1 reports and so on, over time will not be needed, but we're not at that stage yet. Okay, so so just quickly, this is familiar to everybody. Just to reiterate again that of the patients that you do invite, particularly for the first cohorts, actually, who need second vaccination, remember they were the elderly cohorts, over 75, over 80. Most of those patients will probably not be familiar with mobile phones and text messages or even be able to book using those means. So it's very likely a lot of those patients will need to be manually booked and telephoned to book them in. And we would advise practices to continue going through that process as normal, as they're doing now. So looking at their lists of patients who have been invited, those awaiting response, and booking them, contacting them regularly to try and get them booked for their second doses. Okay, so I'm just going to now hand you over to Shanker to talk to you about NIMS integration and some data issues.
Okay, so One thing I would say, just looking at the chat comments, I think we are, after this presentation, we may want to go back and talk again about those reports, so we can really have a sense of the pros and cons and the potential issues. So if I go into this section, that might naturally follow into a further discussion about the reports and the issues or the gaps that we could all face. Okay, so first of all, what is NIMS? Like that abbreviation, tons of abbreviations in the NHS. So it's the National NHS Immunisation Management Service, and we're going to walk through what is, how does that work with accuBook, and what are the issues that we could face going forwards. So next slide. So if something fails again, Alex, just take over on the slides. Okay, but
Sure.
basically we need to walk through what is NIMS. So NIMS is the NHS Immunisation Management Service. It's the national database or repository of I would say the Bible of truth. Who is what do we think our patients have had in terms of COVID vaccines? So when accuBook, when you upload your patients on accuBook, accuBook will automatically check that patient against NIMS and basically sort them. I imagine them a bit like, if you watch Harry Potter, a bit like that, sorting them into the houses. So here, when it uploads in this screenshot below, you can see on the right hand side, it's got a message when you upload saying no recorded vaccination, or on another dummy patient below, first vaccination recorded. So what it will do is it will then think, okay, that patient with no recorded vaccination needs to be invited for their first dose, or that patient who with the first recorded vaccination needs to be sorted for their second dose. So that's what it does at that stage. It's only going to check NIMS at the time you do the upload. And then if they were a first dose patient, and so you've uploaded them previously on accuBook, they've now had their first dose, it will check NIMS again after their first dose appointment. And it checks it the morning after and 3 mornings after. To explain why, what it's basically doing is it is trying to work out from Pinnacle, and we'll come back to what is Pinnacle in a moment, but it's trying to ask from NIMS, can it now see an update that they've had their first dose, and can they resort them to their second dose, that they now need to be invited for their second dose into the future. This may seem a bit confusing and tedious. Why can't accuBook just constantly refresh, keep checking NIMS for any updates? The reason is that nationally the NIMS has what we call an API that allows other software to check against it. Nationally, they've said that you can't do that. There'll just be too much traffic, too much pressure on the system. You can't do it in peak times. They're actually limited on how many checks they can do during a day. And then in the afternoon, you are in the evenings, there's just not enough data processing time to do this. So if we go to the next slide, there is a workaround. What is allowed is per patient, you can do a refresh. So now this is on accuBook. And if you look at your invited patient list per patient, you'll now see that there's this vaccination details section, which shows the date that NIMS was last checked. So for example, here, 18th of February, and then it shows doesn't have any recorded data. So if you hit the refresh button there, which Alex has kindly pointed out with the red, if you click on that, it will then recheck it one by one. So this is tedious, but if you're thinking about it now, when you're even going through your first doses or your second doses lists, we'd probably recommend you hit that refresh button so that you really know the latest version of truth before you call that patient. So this could also help you with even first, if you were doing first dose management. We've had conversations about all these first doses that are still on our system that haven't been booked. It could be worth doing a refresh on them to check, have they gone to a mass vac site? Have they now had their dose somewhere else? And that will just resort it and refresh your first dose list. And then clearly on your second dose, you have that functionality too. But I'm probably highlighting, is it worth going through your first dose list to refresh them to think, do they need to be sorted to your second dose? Okay, next slide. And then how does this work for the patient? So NIMS will tell accuBook what vaccine was given and what date. It does not tell accuBook where was the vaccine given. It just gives those two pieces of information. So it doesn't really matter what appointment slot they had in accuBook for what vaccine session. It ignores it. It assumes that they could have, that we made mistakes. They could have gone into the wrong session, wrong appointment in the past. It goes based on what NIMS is telling them, and that will dictate what they get offered for their second appointment. So you probably haven't seen this section of accuBook, but this is the bit that the leads see that run the hubs. So when you enter in a session, we enter in the hours, how many patients we do, the vaccine type, and we now can enter in whether that session is open to people who only are coming for first doses, only coming for second doses, or whether it's open to patients who are coming for either a first or a second dose. We can also tick a box that says hidden clinic, which means it's absolutely hidden to patients booking on their link, but only us as practice staff or in the hub can see that option. So when now we text our patients for the second dose, what they see on their link will only show them the sessions that are available for them as a patient looking for a second dose. And similar now with the first doses. It's probably worth really emphasising the hidden clinic function, because we know there's a lot of frustration when you've seen slots. So, you know, like that last one at the bottom, the hours 11 to 11:40. Really, this is only for the hub staff on site to manage extras, extra patients. Unfortunately, your practice staff can still see it when they're manually booking patients through their link. We've tried to make it look antisocial 11 to 11:40. We're waiting for accuBook to make that functionality clearer, that it's not really meant to be used or it's a hidden clinic. But what we would say is please cascade in your practice that if you see that strange times, don't book patients into it. Just think of it as a workaround for us. So what's the data flow? When you enter the data, when you vaccinate a patient, we are entering it on a Pinnacle IT system. That's nationally mandated as a system at this point to use. Pinnacle sends that data to NIMS, and it sends that data to you as a GP practice as a coded report. What could go wrong? Well, it could fail at every point in that journey. The biggest failure point could be that it just simply didn't enter on Pinnacle. We've struggled with Wi-Fi on site. The Pinnacle system's not as intuitive as an interface. Sometimes you think it's saved, but it hasn't saved. So you may not have recognized it as a vaccinator. Pinnacle has received more web traffic than Amazon for all the millions of vaccinations happening across the country. So it also probably has system failures within itself. So what could happen is if there's no NIMS data, and if there's no Pinnacle data, that'll lead to no NIMS data and no practice data. So your patient will look like they've not had anything done to them. The second problem is, could you enter the data in Pinnacle, but it just fails to reach the practice? It just didn't get coded into system one. And obviously EMIS practices originally didn't even get any coded information, but maybe your practice just didn't get that report and there was another failure down that pathway. Next slide. So let's walk through some of the consequences, and then after this, Vijay will talk about with the Federation stuff about what work has been done to mitigate this. So let's imagine we didn't get a System 1 report for that patient. That patient will not be picked up on the reports that Alex have showed, and so patients could contact you really frustrated, saying, "Why did I not get an invite?" What we're going to show you is that you need to immediately alert Ealing GP Federation about that patient so they can look into it. Let's look at another scenario. The second dose patient got filtered incorrectly. So you did upload them, but they didn't have their entry. So accuBook thinks they still need a first dose. They get filtered into a first dose. The patient doesn't realise. They click the link, they book a first dose appointment, they turn up, and actually it's the wrong vaccine. Because accuBook doesn't limit them to the particular match for their first dose vaccine because it didn't even realise they had a first dose. So you could get frustrated patients turning up and being turned away, being told it's the wrong vaccine date. Then we've got the issue about stuff. We've picked this up in the chat. I'm not going to cover it here because we'll pick it up in the with Vijay and stuff at the end of this section. But obviously there's a gap. A lot of those spare doses stuff are not managed by this process, and a lot of the staff. Then finally, next frustration as a practice level is the System 1 report will pick up no matter where they had their first dose. So if it was a health professional who had it done in a hospital, or they did it in a mass vac site, you're still uploading them as needing a second dose. There are some mitigations. The booking link makes it a little bit clearer for the patient to say, I don't need it, I've had it elsewhere. And also you as practice staff, there's some mitigations. For consideration, we did discuss with Federation about other options. Could we use appointment data to upload rather than the System 1 reports? So these are things that you're welcome to raise with your PCNs and CDs about. Are there any other approaches that you'd like to be considered? Shall we go into the next slide? So the mitigation. So Vijay, do you want to pick up. I think you're on mute, Vijay.
As you may have already recollected, and there were lots of messages and WhatsApps and emails, especially in the month of January, when there were particular difficulties with Pinnacle, with the system going down and having to use a manual system. So the Federation, looked at the Pinnacle data and did some extraction and looking at how that aligned with accuBook and with System 1, and we worked out that there were at least potentially 312 patients who basically is more or less for the month of January, who we believe came to one of the sites for a vaccination, had the vaccination, but however we weren't sure, absolutely sure we were sure that the entry wasn't in Pinnacle, and of course it wasn't then on System 1. So this Federation had to go back and individually ring each of those 312 patients to ask them whether they did have a vaccination at a particular site and at a particular date, which then had to be manually entered onto Pinnacle. And so it then subsequently will flow into System 1. This is really, really important. And again, it highlights what Shanker said, that if the data isn't as clean as possible, you will potentially have patients being filtered for a first vaccination when they in fact need a second. And also then the confusion about which type of vaccine they require and being booking into the wrong session. So this piece of work is almost coming to an end. The Federation are completing that task of cleaning up those 312 patients, and the Federation will have to repeat that again for the month of February and for potentially for the month, or some parts of the month of March as well. So and that's why it's so important that when we talk later on about how practices upload patients for second vaccination, it needs to be in a staggered way, because we need to be able to clean up the data as much as possible before uploads happen from practices, so that we prevent all the confusions which can happen. The Federation now do have a dedicated email address, which is on the slide deck here, which practices can email any queries or any discrepancies or any data issues that they may have. Particularly around patients who've rang them up to say, I want my, I'm still finding that, want to find out when my second vaccination is, and when you look on System 1, there's no record of the first. So you have the ability now to email the Federation, so the Federation can then look at that particular individual patient and to ensure that the data is correct, and whatever does require entry into Pinnacle, they're able to do that. And so that process is currently live, and I would urge practices to email the Federation with those queries, but be mindful that for the month of January, the Federation are certainly working through that, through those data issues as we speak. Okay. Before we go on to here, before we go on to the staff individuals, there was a number of earlier messages in the chat around the searches, and I think it's probably important that we just recap again what we're trying to say and how we try and help practices.
Alex, can you go back to that slide?
Yeah, can you go back to the slide? Quite rightly so, which was pointed out in the chat. There were some of our registered population who were vaccinated, who were not in the first in the cohort priority groups, 80 plus or potentially 75 plus, and that was really to try and mop up the sessions and slots to ensure that no vaccines were wasted. So how do you pick those ones up? Well, to be able to pick those patients up, you need to run the search everyone else. That will show you all the patients that had a first vaccine code in System 1 during that week period that you are running a search on. It will then also show you who they are and what age they are as well. So before you, if you are going to run that search and then potentially upload that onto accuBook, you do need to look at those individuals on that list to ensure, did they have the first vaccination at Ealing Town Hall, or did they have it at some hospital site? Because you don't want to upload those onto our system, because the assumption is that those ones that had it elsewhere should be going to the same site that they had it the first one. So for example, when I ran this search, I found some of my patients who are in their 20s, 30s and 40s who were health professionals, frontline workers who had their first vaccination at Royal Free, at Guy's, at various hospital sites. So it's important that we don't upload them onto accuBook, because we will end up potentially inviting them for the second vaccination at our site, when the assumption is that they will go to where they had the first vaccination. So one needs to be careful when you doing that. But again, it is important. I do believe it is important to look at that list, because there will be some patients from our practices who did come to Ealing Town Hall in those early weeks, because to try and mop up vaccination. So, you need to do a manual exercise to identify those. Shanker, Alex, did you want to say anything else about that?
Yes, if we can go back, can you go back to that slide, Alex, still? Yeah, so I think what Vijay covered the main point. I just want us to just talk the practicality, why we split it week by week. Also, just to answer some of the chat conversation and emails that we just received. You've seen that there's a data clear up operation by the Ealing Federation. So part of us thought, if you stagger this time-wise, it gives the Federation more time to clean up the data, so that actually you have less issues the cleaner the data is. So you're only almost uploading on a need basis, that those first dates they're really getting close to their deadline, they need their second dose, otherwise, like Alex said, they're going to miss that 10 to 12 week window. So just so you understand that first logic, that uploading in bits helps with, you get better data, and when the Federation feels that they've completed their exercise, maybe we can be more clearer about the uploading, that you could go faster. So that's the first point. Second of all, obviously, if you're a WhatsApp accuBook member, you're all going to be saying, there's no capacity, I can't upload. So that's the second thing, that the leads are also in a difficult place of knowing the deliveries, when they can make these sessions live. So if you flood it with uploading everyone, you're gonna all scream on that accuBook chat saying you can't upload. And then there's a third problem. I mean, Alex, I don't know if you can go to the invite bit. Can we go to the invite? You know that if you go back a few slides to the invite, go to the next slide, next one under this. Okay, so look, we're all busy practices, busy staff members. Look, we know that when we do a webinar, there's a loss in communication. There's a risk that a practice could accidentally, when you, if you look at this, when you can click to do bulk invites, you can invite in 50 sets of 50. There's a filter. I don't know if you see above, under patients 508, there's a names 8 to 7. You can filter it to who has the vaccination dates earlier. There's lots of filters here, but there's a chance that you make a mistake and you accidentally invite too many people, and then they go and book it, and then suddenly there's no slots for the people that are really desperate for their second dose. So uploading in bits helps mitigate any errors that practices could make. So we don't suddenly all accidentally bulk invite too many people at one bit. So there's a bit of logic in this confusion, but we appreciate that the comms will have to keep updating you about uploading, and although this presentation has been led by us, this is obviously completely led by the leads of the services about managing the vaccine deliveries and the flow of patients. It's obviously a totally team effort, and we appreciate that there will be bumps in this.
Vijay, I'll bring up the slide around staff.
Yeah, so I want to now just touch on how we're going to manage the process for staff. And this is slightly more complicated, because as you will again recollect, when we use the System 1 ledger for our staff, we book staff as textual appointments on the System 1 ledger. So they weren't matched to the PDS. These were just textual appointments, and we had primarily the staff's name. We had we entered their email address or their mobile number into that textual appointment. And so looking at the System 1 ledger, there were approximately about 1,000 textual appointments across those 5 weeks. And most of them, primarily majority of them, were staff. And when I say staff, I don't just mean staff from practices, it's also staff from other areas, particularly care home staff and our sessional GPs, our locums, and other staff that were working in and around Ealing, who were also invited for a vaccination either at Ealing Town Hall and Dominion. So we have to have another process to try and make sure that these staff members are captured for their second vaccination, and how we utilise accuBook to do that. So just to recap, so I just want to briefly talk about this Saturday. So this Saturday, we are doing a very, very small clinic of 90 doses on Saturday morning. And these are primarily for all those staff that had their first vaccine on the 18th, 19th, 20th and 21st of December, because those are our priority to ensure that they don't breach the 12 weeks. And that process, we're doing it as a manual process. We're not using accuBooks to do that very small clinic. We've asked practices to email the Federation on a dedicated email address to notify the Federation of which staff had their first on those dates that require a second, and then we're doing a manual process to book them for those 2 hours between 9 and 11 on Saturday. Going forward, we need a much more automated process, because potentially, like I said, there are 1,000 textual appointments that we need to manage. And to do that, there are 2 ways we're going to have to do that. First of all, we're going to ask practices to upload their staff members who've had the first vaccination onto accuBook. So, and this is for 2 reasons. One, it will make sure that those staff members have actually got a record on Pinnacle, and hence is integrated on NIMS. Because when you enter that staff member and you look, and when you entered it, there's no record on accuBook that they even had their first vaccination. Clearly, there's been a data issue, which Shanker described earlier on, so that you need to then contact the GP Federation to make sure that cleanup exercise can happen, so your staff members are being captured, so that we know exactly what vaccine they had and how long it has been since the first one. If the data is correct, once you upload your staff members, it will then filter it for second vaccination invite, less than 10 weeks and more than 10 weeks. And so we want to try and do this exercise. So we are hoping that potentially around of those 1,000 textual, at least 600 will be captured that way. So we've captured 600 of those textual appointments. The other 400 will require a much more of a manual exercise, because they will be, like I said, staff who do not work in one of the Ealing practices. So it's a manual process of contacting those individual staff members, which the Federation are dedicating time and effort to do, to ensure that those are then captured onto accuBook as well, so they will be able to be invited for their second vaccination. So it's quite a task that we need to undertake to do this. You may ask yourselves, why did we do this in the first place? Why did we use textual appointments for staff members? And there are a number of issues, and the main issues around information governance and patient staff confidentiality. Because if we actually would have registered them onto the extended access hub site, they would be a registered patient on that, and then potentially anyone who has access has got access to those staff members' patient records. So it's clear that we needed to safeguard those staff in terms of their information governance and patient confidentiality perspective, hence the reason why we used the textual system to do that. So and hence we now have a task to ensure that all those staff do have their second vaccination in a timely way, and that none of them are breached beyond the 12 weeks. And this is an ongoing rolling process, which is the Federation, along with the support of the CCG, are currently undertaking to make sure that we can do that. So finally, I wanted to talk about any other business, and the key bit of business I wanted to talk to you about, and just give you a high level information, is the frustration that we're hearing from, the WhatsApp messages, some of the emails, some of the noise traffic around our patients in priority 1 to 6 who still require the first vaccine, particularly those one in priority 6, the age 16 to 64, of those high-risk patients who still require their first vaccinations, but we don't have any availability or sessions available at Dominion and Ealing Town Hall. As you know, both sites will need to concentrate on second vaccinations as of the 15th of March. That is the key. We need to start rolling that out. We all need to remember that we've got both those sites have done 61,000 first vaccinations. So in the months of March, April, and probably it will spill over in May, they need to concentrate, and their priority is to vaccinate those 61,000 patients who require a second vaccination. So we're going to get frustrations in our own practices from our patients who are still waiting for their first. So currently we're working through a process to enable our patients to book into cphouse using our accuBook system and the original accuBook first vaccination invite. There are a number of steps for us to enable us to do that, including the integration of cphouse to this booking system, because as you know, cphouse, the MAS site, uses the national system, which is called qFlow, and also a second system which was originally used by the MAS sites called Simply Booking. So there is some complexities around this, but we are confident we can do this, and we are hoping that we can potentially go live by the end of next week, so that we can then manage our patients, so our patients have an extra choice in terms of booking their first vaccination. We are also trying to ensure that their second vaccination for those that book into cphouse using accuBook is managed by cphouse, the national system, using qFlow. So we ourselves, in our practice, are not continuing that perpetual issue around second vaccination invite. So that's really important for us as individual practice, but also as a system, to ensure we're able to do that. And we won't go live until we're able to do that. So so when your patient books their first appointment in cphouse using accuBook, the day after they book their first appointment or had their first vaccination, they will be able to go onto the qFlow system to book their second one between 10 and 12 weeks. That is what we're trying to work out. That is what we hopefully will be able to work out in the next 7 days, to enable the system to work seamlessly in a much more automated way, and so for our practices to really concentrate on what we need to do in terms of our managing our patients with business as usual in general practice, but also our two sites to concentrate on those second vaccination that we need to undertake over the next couple of months. I think we have run over, because I think we were 45 minutes, weren't we, both Shanker and Alex? We have run over, but if there are some questions, we're happy to stay on for a little bit longer. If anyone has some questions that they want to ask, we've tried to answer as much as we can in the chat, but I'm happy to take any questions now. I can't see any hands up. Shanker, Alex, can you see any hands up? Fine.
No hands at the minute. I think we've answered most questions as we were going.
So the question, where is CP House? The CP House is on Uxbridge Road. It's, to be honest, it's not quite opposite Ealing Town Hall. It's just further down Uxbridge Road from the Ealing Town Hall. It's a large sort of business type office building, which was actually originally used by London North West Hospital Trust for their community administrative site. And CP House has 2 floors, the first floor and second floor. They have a maximum potential of 1,000 vaccinations per day, as it currently stands, with the potential to increase to further floors. But at the moment, that's what their potential is. Anything else from the chat, guys?
Can we pick up this one chat comment about the concept of space? So just to clarify, deleting patients or cancelling invites won't necessarily need to be done just to clear up space. When we talked about capacity, when you upload a patient, after 24 hours, they don't count against any sort of capacity or space. So only do it if it suits your practice systems, that you're fed up of calling the same patients over and over again, but don't do it just to release space.
We've got a hand up, Pawan, you got a question?
Hi Vijay, just wanted to know, on the searches which we have for the second vaccination, is there any way we can find out which vaccination they have had the first one, especially when we uploading, whether it was a Pfizer or it was AZ? But I know more December one were kind of, I think, Pfizer at that time. AZ came quite later. But how would we find out when we are even manually screening patients to book?
The slide that we showed you, which when you look at your invite list, and we showed there's a vaccination detail bit, it just comes up. I don't know if Alex can show it, but it will show you the NIMS data showing what
in the accuBook,
yeah, in the accuBook. When it's checked against the NIMS, it will show you the date and the brand of vaccine, but it won't show you where it was done.
Okay, and that's something that we have to discuss with the patients.
No,
is that what you're saying?
You don't.
We're Go on, Shanker.
No, so what the whole purpose of using accuBook, one of the reasons we did the switch is because it integrates with NIMS. So it's trying to do the sorting for you. So it then thinks it knows what dose that patient's had from NIMS. So if the NIMS data is correct, accuBook will be correct, and then it will only show the patient an appointment that would match them getting a dose of the same vaccine. So it's trying to do all of that for you.
All right. Yeah, that's fine. Thank you.
Yeah.
Can I just?
We are allowing our patients to use both sites. For this second vaccination, we're not strictly saying that because you had your first vaccine at Dominion, you have to have your second at Dominion. Both sites. Both those coordinating practices are. We're working as one system across Ealing, so the patients will be able to book at either of those 2 sites for the second vaccine. But what accuBooks will ensure that they can only book a Pfizer if they've had first Pfizer, or they only can book a Z session if they've had first AZ.
Vijay, there's a couple of questions around first vaccines. Anne was asking where should currently nowhere for patients to book without first vaccine to be able to be booked into. So next week there are 2 first vaccine sessions, I believe, still happening at Dominion, although I'm not sure if there are any slots still available. And then beyond that, as discussed already by Vijay and Shanker, we're hoping that the first vaccine implementation with CP House will be live, and you'll be able to book those patients using accuBook through that method. But there was another question by Catherine, and Catherine, do you want to just clarify what you meant about a specific cohort of patients that just can't go to CP House?
Yeah, I think we have quite a few. They don't necessarily have cars, or they're not particularly. They don't have. They're not well resourced. The over 60s can book into the mass vac sites, and they're actually a lower priority group than the underlying conditions group, who have got a lot less access. So I just wonder how we support those patients. I appreciate technically it's quite difficult for you, and I appreciate you setting up cphouse, which is great, but are there other ways we can support particularly vulnerable patients to access more local sites, even if it means us speaking to a local site and confirming that they do meet the eligibility criteria?
Yeah, so you make a very good point, Catherine, because unfortunately the national booking system is is potentially about 3 or 4 weeks behind in terms of where we are currently in terms of our priority 1 to 6. As you know, at the moment the national booking system only allows people to book who are over 60 or they've had a shielded letter. You know, so our 16 to 64 high risk cohort, a majority of them can't book on the national booking system, which is a huge frustration all round, because the national booking system is also how you access not only the mass sites but also the pharmacy sites as well. So it is a frustration all round, and you know, we are all hoping that they will soon catch up and enable our patients to book into those mass sites and those local pharmacy sites which have been started across Ealing. The only other way to do it is Catherine, the only other way to do it is twofold. One is by, you know, individually contacting those pharmacy sites and asking them if they will manually book some of your high risk patients that have been asking for their first vaccination. That's one way of doing it. The other way potentially to do it is to have some pop-up clinics in our local patches to do first vaccinations of AZ, which again, it is the ask from NHS England for the PCNs to continue doing priority 1 to 6, has pop-up clinics for those hard to reach groups or populations, and you know, using the AZ vaccination. So that's where we are at the moment. You know, we're hoping that cphouse will take some of the pressure, but it won't take all of the pressure off. And we have to try and just wait and see how the national booking system hopefully will catch up in the next 7 to 14 days. Is there anything else on the chat that we need to address?
So there's a few repeated questions that have already been answered, I've just noticed. So it might be worth, I'm not sure if any of our admin colleagues are around from the CCG, whether or not we could do a table of questions and answers, and perhaps us three can go through and just clarify a few of the points. But nothing new that I can see there. And Mo's asking, can patients go to pharmacy to get their second doses if needed urgently for one reason or another? So again, strictly speaking, officially, Mo, the pharmacies are following the mass vaccine sites in terms of the cohorts they're able to book. But I know, and several other practices know, that some pharmacy sites are actually quite flexible in terms of accepting patients where there are special circumstances if they're outside the cohorts that are being nationally invited. So the answer is potentially yes. I think that's it in terms of questions.
Yeah, I think so. So let's.
I mean, just two closing lines. I mean, I know we've repeated some things and some things are a bit things, but one key point is, if you've seen an issue with a patient, it may be frustrating, but act fast. Don't, and you know it's difficult to know what is the fault. Is it accurate? Is this? But what we're saying is get as much information from that patient about as you can. You know, what date, what dose, like what brands, you know, and contact the federation as soon as possible and try and and we have to try and resolve it as quickly as possible. So just so that your staff know that there is a system to follow. If you get that basic one done, and there will be updates. This is a total team effort. So we're here as partly as the enablers of the IT, but obviously your PCN clinical directors, the leads, are a much part of this process, and some of this detail will flow from them as well about how they're going to release the sessions. So just today, after this webinar, we're asking you to upload, but just to be clear, we're waiting the confirmation from the CPCs about how they want you to then click the invite buttons and how many and the numbers, and that may follow very soon.
Yeah. So upload up until 31st of December. And we actually literally have a meeting with the PCN clinical directors after this, where we will hopefully try and clarify the second vaccine sessions that will be put up as of next week.
Yeah, because right now, literally after this meeting, if you clicked it, you'll get a message saying you cannot upload or you cannot invite. So just wait for the update after this. But we want you to feel familiar with the functionality and do the upload bit at this stage.
Yeah. So only upload up until the 31st of December. Do not upload any beyond those dates at this point in time until we've got clarity around the sessions that are coming through for second vaccination. And this will depend again on the delivery schedules that we will get notified about. So it will have to be an ongoing weekly staggered process to upload for your second vaccinations. And I think what is important is that your first lot of cohort, your over 80s, as you all remember, we booked them all manually using the remote booking on System 1, and a lot of those may potentially don't have mobile phones or have the ability to do their own booking using the textual mechanism. So there will be a task for practice to manually book these over 80-year-old cohorts into the dedicated second vaccine sessions, which once the CDs have published them, you'll be given the green light to be able to manually book them. But at this point in time, get them onto accuBook so that they are filtered and registered and recorded on accuBook, and they're in the right filter, less than 10 weeks, more than 10 weeks. It's the ones that are more than 10 weeks is the ones that we will be concentrating on first over the coming weeks. Okay, so we'll end that now. So thank you very much for everyone for attending. Thanks again to Shanker and Alex for all their efforts to put this webinar together. And we will hopefully be able to update practices over the coming days and weeks regarding the upload and invitations.
And Vijay, we just want to say a big thanks to you. You're on annual leave, and yet again, you're here. This is one of his babies. So he's been putting in a lot of hours, and we kind of said to let the baby. He didn't want to, we'll be his childminder, but he's here. So thank you, Vijay.
Thank you, Vijay.
Right. Thanks a lot,
everyone.
guys. Thank you very much, everyone.
Bye.
Have a good afternoon.